In this video, we examine the effects of curcumin against cancer. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. Curcumin is derived from the common orange herb turmeric and has been used as a part of Ayurvedic or Indian medicine for thousands of years. It is the dietary supplement that attacks cancer in the most number of ways. A 2009 review identified 32 unique pathways that it used to attack cancer. There is so much evidence on behalf of curcumin in cancer treatment that we are going to skip the cell line and animal evidence and go right to the human evidence. Prostate cancer patients took either 1.4 grams of curcumin or placebo daily for 6 months. Only 10% of the curcumin group had a progression in their PSA levels, while 30% of the placebo group did. Adverse events were also higher in the placebo group than in the curcumin group. 6 grams of curcumin daily concurrent with chemotherapy drug docetaxel improved responses in patients with breast cancer without increasing toxicity. Curcumin lowered VEGF, a molecule that is a marker of angiogenesis which fuels cancer, by 30%. Of the 9 patients evaluable, none had progressive disease. 1 had a complete response, 5 had partial responses, and 3 had stable disease. A picture of a breast cancer patient whose lesion went from 2.5 centimeters x 1 centimeter to 1 centimeter to 0.5 centimeters when adding curcumin to docetaxel. Curcumin concurrent with standard of care improved markers of inflammation in a human trial of head and neck cancer. 52 pancreatic cancer patients, primarily stage 4, received gemcitabine, the standard of care chemotherapy for pancreatic cancer, concurrent with Mariva, a commercially available version of curcumin with higher than normal bioavailability. With just gemcitabine, the expected disease control rate, responses plus stable disease, would not be over 30%. In this study, the response rate was 61.4%, 27.3% partial responses, and 34.1% stable disease. Stage before colorectal cancer patients added 2 grams of curcumin daily to their standard of care chemotherapy cocktail, known as Folfox. The group that took curcumin had a distinct survival advantage over the control group with no additional toxicities. The group that added curcumin into their chemotherapy regimen is represented by the solid Sue-Fox line, while the chemotherapy group without curcumin is the dashed Folfox line. 4 grams of curcumin added daily to gemcitabine in refractory, advanced pancreatic cancer patients produced a control rate of 45%, 9% partial response, and 36% stable disease. The fact that these people were refractory means no response was expected with standard of care alone. People with oral leukoplakia, a potentially malignant lesion of the oral cavity, received either 3.6 grams of curcumin daily for 6 months or placebo. 67.5% of the people receiving curcumin had a complete response versus 55.3% of the placebo group. The book, Cancer Self-Defense 101 Quick Tips to Help You Survive provides several other examples of curcumin being effective against cancer in human trials. Curcumin's synergies with other dietary supplements include piperine, raises curcumin's bioavailability 2,000%, resveratrol, berberine, sulforaphane, milk thistle, and more. It also strongly synergizes with metformin. One potential side effect is that curcumin may interact with blood thinners. Additionally, curcumin does reduce the bioavailability of the breast cancer drug tamoxifen 8% and 12% when curcumin is given along with piperine. This is because curcumin can inhibit cytochrome P450, which converts tamoxifen into its active form, endoxifen. For more information, see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.